everyone, I'm Dr. Scott Leydig, and I'm a licensed clinical and sports psychologist, and I work every day with athletes, dancers, and performers on all levels of expertise, and I help them with all the challenges that come with being a professional. As a father of 3 kids, I'm looking to help spread my knowledge and expertise to parents, coaches, and young athletes to help them maximize their youth sports experience. Welcome to Ask the Experts. So unfortunately, your child gets injured. This happens all the time in sports, but I am here today to talk to you about what I see in my practice from the mental health side that's going to help you all cope with your child's injury from your perspective. What can we do in order to make this process a little bit easier for them during a difficult time? So unfortunately, when our child has an injury, they suffer with 3 different challenges post-injury from the mental, emotional, and social standpoint. And that first one that I see all the time as a sports psychologist is identity loss. As an athlete, that is their identity. That's who they are. That's what they do. They eat, sleep, breathe their sport. And when they don't have that, they lose a sense of self. And that can cause a lot of different issues like social support changes. If we are with our teams all day, every day, and we get hurt and we either can't be with our team or don't want to be with our team, then we tend to feel isolated. And that can lead to something called grief. We can have a grief experience when we are dealing with an injury that might mimic even a potential depression. We might experience sadness, social isolation, feeling worthless, feeling hopeless. And so those are the 3 challenges that I tend to see with an athlete that's struggling with a physical injury. So the top 3 solutions to help your child cope starts with encouraging emotional expression. This is something as an athlete, we're taught to not express our feelings. We're not even taught to identify those. But the injured athlete experiences a ton of different emotions, and it's our job as parents and coaches to be able to try to facilitate that emotional identification and expression. A lot of times I actually use emojis with my teenage patients because they don't know how to articulate their feelings. But this day and age, if I say, well, send me an emoji of how you feel, they send me 17 of them, and then they describe them, and then they can really open up emotionally. So we try to find those channels that you can do that. The next solution that I want to talk about is rebalancing their social support. So earlier I mentioned they might feel really isolated. They might not want to be with their team. So there's 2 solutions to that. One is try to keep them with their team. It might be difficult for them to deal with being on the bench when they're watching their team at practice or at the games, but make them go. Make them go to the team meetings. Keep that huge piece of their athletic identity intact by being with their teammates. But if for some reason they can't because of their injury, or if they have let's say a concussion or a severe injury that needs surgery, then try to make sure that they're well balanced from the social standpoint. Make sure they have friends outside of their team. Make sure they're hanging out with family. Make them go into a club at school. If you can try to do these different things to have a well-balanced social portfolio, that will help them cope with these difficult challenges from the social standpoint. And the last solution that I want to talk about is adhering to medical advice. There's 2 different ways that I see this play out in my office. One is fear of re-injury. I can't tell you how many times I've had athletes come to my office and say, I'm so scared to get hurt again. I never want to deal with this physical, mental, emotional, or social pain ever again. So they tend to potentially underutilize their physical therapy services, or take it easy and don't really do all the reps that they need to do, or all the PT at home if they're injured. And so that's something that we need to talk to our kids about, is realizing that if you find that happy medium, you shouldn't theoretically get hurt, and you should promote your sense of physical well-being if you do the right things from the rehab standpoint. And the other thing that happens is sometimes because of that athletic identity is missing, they want to jump right back into their sport a little bit too fast. So making sure that we find that well-balanced approach to doing the things that the doctors say, not doing it too little, not doing it too much, is one of the biggest solutions that I can offer to you and your children during your post-injury rehab. The last thing I want to mention to parents is be patient. This is a long rehab when it comes to some of these injuries that your child might suffer with, and it can be a very difficult process. But know that if you do as best you can as a parent, hopefully they do the best that they can as an athlete, you will get there and they will be healed and they will be back out there on the court or the field enjoying what they love to do all the time. And so be patient with this process and you'll get there soon enough, hopefully. So if anybody needs any help from a sports psychology perspective, feel free to reach out to me at drleydig.com or maxu.co, and I would love to help you meet your athletic needs from the sports psychology perspective.